Roberto is an 8-year-old male who presented to Texas Children's ED 3 days ago for headache, vomiting, and possible seizure-like activity. Roberto's mother reports he was in good health until 11 days ago when he had one episode of decreased responsiveness, syncope, and a seizure-like activity while bathing. Mother reports he had stiffening of the extremities, full body shaking, and eye rolling during this episode. Mother reports she called EMS promptly. However, due to the recent hurricane in Houston, it was delayed a bit, and by the time EMS did arrive, patient was responsive, however slightly sleepy. Her mother, EMS, did do a strong sternal rub, and the patient became baseline other than being a bit sleepy. Reportedly, an EKG was obtained at the scene, and it was normal, and he was told he was most likely had a virus at that time. Patient continued to have worsening headache with one episode of daily emesis, which prompted mother to take patient to an outside emergency department where he was diagnosed with migraines. Patient was prescribed Imitrex for his migraines. Mother was giving the patient Imitrex as prescribed, however, due to nausea and vomiting, patient not tolerating the medication, and worsening headache, prompted mother to bring patient to Texas Children's Emergency Department. She reports intermittent fevers for the past 2 days, Tmax 102. However, fever has since resolved since yesterday. Denies any recent cough or congestion or sinus pressure. Denies any difficulty breathing. Denies ear pain. Denies sore throat. Denies rash. Denies diarrhea or abdominal pain. Denies blurry vision. Denies headache. Denies any recent injuries or trauma to the head. Denies any prior history of headaches or migraines in the past. Denies any history of cardiac defects. Denies any history of syncope. Denies any dental pain. Denies any recent dental procedures, and patient does go to a dentist regularly. Patient was full-term vaginal delivery and was able to go home with mother without any complications. Patient does live at home with his mother and grandmother and attend the 3rd grade, and no other siblings are at home. Denies any smoking in the home. Denies pets. Patient's vaccines are up to date. He denies any recent travel and denies any known ill contacts, and no significant family history for migraines or any cardiac issues. Patient has never been hospitalized before. There are no prior surgeries. Denies any daily medications other than a multivitamin. Patient has been taking Tylenol, PRN for Tylenol for headache and fever, as well as Imitrex for the possible migraines over the past 2 days. So presenting to the ED, upon presentation to the ED, patient was alert and oriented, afebrile, and vitals were stable. There was noted of mild weakness of all 4 extremities, about 4 out of 5, and seemed a bit slow to respond to questions, however did answer all questions appropriately. Due to symptoms and clinical findings, a head CT was obtained and labs were also ordered. All labs, including a CBC with diff, a CRP, ESR, BUN, and creatinine, were all unremarkable. The head CT, however, did show a hypodense mass measuring 3.6 by 3.1 by 2.9 centimeters in the left temporal lobe with accompanying vasogenic edema. The mass effect was causing left uncal herniation and 1 centimeter left to right midline shift. The hypodensity of the mass and accompanying vasogenic edema was concerning for a left temporal abscess. Due to the findings, neurosurgery was consulted and instructed to give patient 4 milligrams of IV Decadron and loaded with fosphenytoin for seizures. Patient was admitted to the neurosurgery service where he was taken for surgery. A left temporal burr hole was performed for ultrasound-guided aspiration of brain abscess, where 25 cc's of purulent drainage was drained from the abscess and sent for culture. Initial tissue culture was notable for gram-positive cocci in pairs on the gram stain. Culture is still pending. Patient was immediately started on Flagyl, ceftriaxone, and vancomycin for bacterial coverage and fungal coverage until culture results were complete. Patient was also started on Keppra for seizure prophylaxis, Zofran Q6 PRN for nausea vomiting, Docustate for a stool softener to reduce straining, and IV fluids until patient regains PO status of D5NS at full maintenance. So upon exam, patient is 54.3 kilos, his heart rate is 92, respiration is 22, temp 37.2, BP 105/72, and 100% on room air. Patient is currently denying any pain. Patient is awake and alert, lying in bed upon assessment, and no acute distress. His head is normal cephalic. He does have a dressing over the left temporal region that is clean, dry, and intact. His ears, his TMs are normal. His nose is clear, no rhinorrhea present. Mouth, moist mucous membranes, no erythema, edema, or exudate. Normal dentition without any signs of obvious cavities. His eyes conjunctiva without erythema or discharge. His pupils are round, equal, and reactive to light with 3+ bilateral pupils. Neck is normal range of motion, normal rate, rhythm, and normal heart sounds. His lungs are clear bilaterally, and he's also in room air. His abdomen is soft, non-distended, does not have any guarding, and does not appear to be painful with palpation. He does have normal range of motion of all extremities, no swelling or deformity. It's noted that he's now 5 out of 5 for muscular strength. Neurologically, patient is alert and oriented ×3. He has symmetrical facial movements. He follows commands appropriately. He has intact reflexes and a steady gait. Skin, warm and dry, no rash noted. He does have an IV in place in his right anacube as well as his left hand. So problem list for this patient is health maintenance, brain abscess, headache, vomiting, seizures, syncopal episode, and risk for infection. Differential diagnosis, a brain tumor, otitis media causing the brain abscess, a sinus infection causing the brain abscess, endocarditis, meningitis, and migraines. The impression of this patient, again, he's an 8-year-old male with headache and vomiting for 11 days and possible seizure 11 days ago and intermittent fevers for the past 2 days. CT findings are consistent with a left temporal brain abscess from an unknown etiology. Patient has remained afebrile with no acute neurological defects. Labs are unremarkable, other than now the culture is growing a presumptive strep pneumo from the brain culture, and fungal culture is still pending. The patient is stable at this time, however, we will continue to monitor his neural status and risk for infection. The assessment and plan for this patient continue to monitor neurological status and for signs of infection, consulted infectious disease and continue to follow their recommendation with the antibiotics, consult ENT to check for infectious source for the ears, throat, due to unknown reason for this abscess. Obtain an echo to rule out an underlying congenital heart defect as well as endocarditis. Now with a known presumptive strep pneumo growing, we were able to discontinue vancomycin and ceftriaxone, and we'll start the patient on penicillin G IV, 4 million units per dose every 6 hours. Also, we'll continue Flagyl, 500 milligrams Q8 on this patient until fungal results are obtained. Do recommend a PICC line due to the long-term course of antibiotics. Continue Keppra for seizure prophylaxis. Continue to follow all pending cultures. Recommended while patient is on all these IV antibiotics, a CBC with differential. Platelets, BUN, creatinine, AST, and ALT are obtained Q Monday and Thursday, as well as an ESR on every Monday. And as well as the labs, possibly repeat the a CT, which they did 2 days after surgery, and it did show a significant interval decompression of the left temporal mass with improved mass effect and midline shift. So we'll repeat the CT if any other significant changes arise. Continue to advance the diet as tolerated, and then manage patient's pain and watch for worsening headaches closely. Thank you.